Welcome back. My name is Dr. Carl Baird, and today's video is for anybody over the age of 40 that's been dealing with some knee pain that might be making it hard to walk, squat, or even to climb stairs. And so what you need to know is this pain isn't always just a part of getting older. It's weakness that leads to more impact on your joints, which causes the pain and arthritis as we get older. So what I'll do in today's video is show you 5 of my favorite strength exercises to help you build strength to support the knee and build long-term joint health. Let's go ahead and get started. Weakness in your glutes is one of the primary contributors to knee pain in adults as they get older, which is why the first exercise I chose is the glute bridge. This is a great exercise not only because it's effective at strengthening the glutes, but it's also safe, meaning not a lot of impact goes through the knee itself, and it's scalable. So there's so many different variations of the glute bridge that can match any ability level from beginner all the way to advanced. So let's just show the introductory glute bridge. We'll start on our back, feet flat on the floor, knees bent, and from there all we're going to do is press through the feet to lift those hips up. And again, you can do a self-check just by pressing the glutes. You want to make sure that they're nice and firm and contracted, and come back down. And so that's it for the glute bridge. A couple things to watch out for. If you're feeling it more in the hamstrings, it might be that your feet are too far out. So you want to pull them in, make sure it's in the glutes. If you're feeling more of a stretch in your quads, it's probably because your knees are too close to the hips. So again, it's about finding that nice middle ground. Once you find that, it's pretty straightforward. Go ahead and give that a try. Another muscle that's commonly weak in adults with knee pain is the glute med. So this is the muscle that lies on the outside of your hip and controls a lot of the side-to-side movement at the knee, especially when we're standing. And so it's really important that we strengthen this muscle as well. The clamshell is a great, safe, and effective exercise to target this muscle. I usually like to take it, if it's possible, a step further, and I like the side plank clamshell because this also strengthens your lateral core, which is important for overall strength while targeting those glute meds as well. So to perform that, we're going to start on our knees, elbow directly below the shoulder. Raise the hips up off the ground. So in this top position, your body should be in a nice straight line, and just make sure that your shoulder's not rounded forward like that your shoulders are nice in a line as well. So to perform the clamshell, you take this top leg, keep that feet together, and lift that leg up. Come back down, and repeat. So it's a simple hold here. And what I like about it is it not only targets this top glute med that's doing the work, but you'll really feel it in this bottom glute med as your knee presses against the ground. Give that one a shot. That is the side plank clamshell. The step up is one of my favorite functional strengthening exercises to help build strength in muscles that support the knee, and it's relatively straightforward to perform as well. I also like that it's very scalable, so you can start with a very easy variation and quickly make it more difficult to match your ability level. So let's start with the easiest. And the first thing just has to do with the height. So if you have significant knee pain or you're not feeling strong or confident, the key is to just start with a lower height. So for me, I like these yoga blocks, but you can use anything that you have to step up on. And from there, all you're going to do is press up off this top leg to come up and lower yourself back down. Only thing you want to watch out for is you're not pressing up off your back toe and pushing yourself up. It's a common compensation, especially in people that are struggling with knee pain. They might be subconsciously trying to protect that joint. So make sure, again, you're pressing up off this top leg. And then again, like I said, if that's too easy, the first thing you can do is just raise the height. So for me, I can add more blocks, perform the same movement. And if that's even too easy still, it's easy to add weights. Just grab 2 dumbbells, hold them at the side, and perform that step up as well. Give that a try. Let me know how it goes. The squat is another great exercise for knee pain. And I know what you're probably thinking. Maybe your doctor or physical therapist have told you not to squat with knee pain, or you're just thinking to yourself, how am I supposed to perform the squat if that movement hurts my knee? And so I'll show you a few different variations that you can use to build the strength and confidence to be able to perform the full squat. So to perform the easiest variation, we use a box or a chair, and we do a simple, what's called a sit to stand. So start sitting on a block, press through my feet to come to the standing position and come back down. Once you feel strong and confident in that, you can move to the box squat, which is going to be the same movement as that sit to stand, but now I'm starting in a standing position, sending my hips back and tapping and coming up. And once you feel confident in that, you can get rid of the box altogether and move to your air squat. Now, one thing you may have noticed with these 3 variations is that I'm really focused on initiating my squat by sending my hips back and then bending the knees. And that's just going to be an easier way to perform the squat if you have knee pain versus the other option, which is unlocking at the knees when you squat down. Again, not a bad variation, but if you're someone with knee pain, you might just want to tweak it a little bit by sending your hips back first and then squatting down. Give that a try. And lastly, we have the Suitcase March. This is a great way to build functional core strength, but I really like it for knee pain as well because it helps to improve balance and single leg strength as well. So to perform relatively easy, just grab kettlebell. You can also use a dumbbell. Start with a light grip on that weight, roll those shoulders back, and then all I'm going to do is march in place. So start with my opposite leg, hold it for a second there at the top, come back down, and move to the left. Again, so the key is to be able to hold that balance. If you're struggling with your balance, it's okay. Just lift the leg as high as you can, even if it's here, and come back down and then slowly work your way up. But again, the more you do this, the better you'll get, and it's really great for knee pain in adults. So there you have it. That's 5 of my favorite strength exercises designed to help reduce knee pain and build long-term joint health. And just a reminder, the purpose of these exercises is to build strength in the muscles that support the knee, not just the knee joint itself. And that's important to remember, that stretching alone isn't something that's going to reduce knee pain. Building strength helps limit impact at the knee and build resilience so that you're able to keep active and maintain your lifestyle as you get older. So that's all I got for you today. Again, if you are interested, be sure to like and subscribe my channel. And I do offer a free 8-week strength program, which you can find the link in the description down below. So be sure to grab that. And that's all I got for you. Again, if you have any questions or comments, leave them down below.